Here now with analysis of all these developments is Minnesota Congresswoman Michele Bachmann. Congresswoman, welcome aboard.
Sean, thank you very much. Thanks for the opportunity.
All right, Congresswoman, first, is the government option dead? Is health care dead? Is it dying, withering on the vine? Where does it really stand now?
Well, we could only hope that it is dying and withering on the vine, but I think what this shows is the temerity of the American people. This is not inevitable. This doesn't have to pass. The American people can have a victory by not having socialized medicine, and I think what this demonstrates is that the American people are getting through. 61% of Americans do not want to have this bill. Only 34% are in favor. So I think this is not the time for the American people to let their foot off the gas. They need to be very clear with their members of Congress, especially their senators, that this is a no-go. It's a non-starter.
Didn't the president just meet with the senators, what, 2 Sundays ago, and now he's going to have this meeting and people have been summoned to the White House? It seems to me that the president at all costs is going to try and get a bill passed. Does it matter what it is in the end, that he's going to be able to go out there and claim victory? We'll talk about this later. It was on 60 Minutes last night. You know, he graded himself a B+, but an A- if he gets health care passed. Is this something he has to get done politically?
I believe that he thinks he needs to get this done politically. I think the Democrats, both in leadership in both chambers, believe that they need to get this through, but that's not what the American people think. The more information the American people get, for instance, that there's a marriage penalty contained in this bill, that it is major redistribution of wealth, that there's an iron ceiling on wages above $58,000 a year. If you have a joint income, $58,000 or below, you receive the government subsidized health care. At $59,000 and above, you don't, and you're looking at having to pay for health care out of after-tax income. People are waking up that they are going to be scrambling for health care, that the cost will be far in excess of anything they ever thought. This will be, Sean, the largest tax increase on the middle class in American history. That's why the American people don't want this bill.
Examine the Senate for me. What senators, Democratic senators, do you think would really oppose this bill?
I think that they'll have trouble with Blanche Lincoln, with Ben Nelson. I think Lieberman will be trouble for them as well. And beyond that, it is tough to say how much farther they'll be able to go out. I think our Minnesota Senator Al Franken is probably a lock, but you know, beyond that, there aren't too many that they can go to.
Well, all right. So, but the power of that Oval Office. It's very powerful. They're going to bring these senators in one by one. There's going to be a lot of arm twisting. We know Mary Landrieu was bragging about the $300 million she got in the earlier write-up of the bill. So the question is, you know, when the president says, I really need you to do this for me, I will help you out, I'll campaign for you, I'll raise money for you, I will take care of your district, your state, you know, what are the chances that somebody's going to be able to resist that?
Oh, I think that people very definitely will be able to resist that, especially when they see how the numbers are tanking in state after state across the country for Democrat candidates. Overwhelmingly, Harry Reid is in very big trouble in his state. Chris Dodd is in big trouble politically in his state. And I think that this is the read now that Democrats are getting across the country as they're looking at their polling data. The American people are rejecting not only just Democrat health care, but Democrat cap and trade, Barney Frank's financial services bill, bringing prisoners from Gitmo into the United States. The American people are horrified at what they're looking at.
I have some ideas. Portability is one. Tort reform is another. Medical savings accounts, tax cuts for people that don't have health care. I never thought you had to overhaul the whole system that a lot of people found to be the best in the world. But how do you respond to the charge, the bumper sticker, the slogan, the Democrats keep saying, well, the Republicans are just the party of no. How do you respond to that?
Well, we have a very simple plan, Sean. It's every American owns their own health care, not their employer, not government. They can purchase any plan from any state in any amount they want, do it all with their own tax-free money, fully deduct the rest of it. True lawsuit abuse reform. That cuts health care costs for 95% of American people. For those who truly, through no fault of their own, can't purchase health care, we can take care of those people with vouchers, with tax credits. Bingo. Try that rather than a huge imposition of government bureaucracy. People would much prefer to see us try innovation and competition, not an iron ceiling on wages post $59,000.
Look, you're there in the Congress. Have Republicans even had an opportunity to present these plans and integrate these plans, at least in the House where you are?
Not once. If you recall, when President Obama spoke to us in the joint session, he said, if you've got ideas, write to me. I wrote to the president. Many of my colleagues did. We didn't even get the courtesy of a reply. He has been completely unwilling to speak to us. And remember, he is the one who promised that these health care debates would take place on C-SPAN. Not only that, his transparency committee met behind locked doors with no media. These people aren't about transparency. They've been complete and total frauds and hypocrites on this issue. We need bipartisan reform, and we Republicans are there ready, willing, and able. We want bipartisan reform. Let's scrap what we have, and let's move forward.